And since it was approved months after the Pfizer and Moderna vaccines, Johnson & Johnson makes up only a small percentage of the shots that have been given out. Here in South Carolina, there have been more than 1,500,000 total doses of 3 different vaccines. 80,000 of those doses were the Johnson & Johnson vaccine. That amounts to about 5.25% of all shots. The majority of doses have been the Pfizer vaccine at 56%. 38% of those doses have been the Moderna vaccine.
Whether you've gotten the Johnson & Johnson shot or you're just thinking about getting it, we know you have questions. So Kaylin Hagwood went to the experts to get some answers.
Kevin Miller received the Johnson & Johnson vaccine.
About a month ago.
So the news that distribution was brought to a halt was a little concerning.
Alarmed, very alarmed, especially if you just received that same vaccine.
While he experienced no serious symptoms,
I had no issues.
If he had to ask a doctor,
I would probably ask my doctor, check me and see if I got any blood clot.
So how likely are you to experience the same issue from the Johnson & Johnson vaccine? We took your questions to the experts. Dr. Helmut Albright is an infectious disease specialist with Prisma Health.
The likelihood that you will get a clot from COVID is several thousand times higher, actually, than getting it from the vaccine, just to keep it in perspective.
One positive, Dr. Albright says, this type of blood clot can be treated by a doctor.
It's a little different than treating regular blood clots, but we know how to do this. So if this is detected, we can reverse this.
Overall, Miller says he feels okay about the shot, and if allowed back, he hopes others won't be discouraged.
Let's give it a chance.
And he's not the only one. Roosevelt Harris, who received his dose last week, agreed.
I'm not concerned about that. Now, if you're talking about a massive amount of people compared to the amount of the millions of people that has taken the vaccine, I think it's really working.
For the News 19 vaccine team, I'm Kaylin Hagwood.
If you did get the Johnson & Johnson vaccine more than a month ago, the CDC says your risk of adverse effects is very low. But if you have received the shot within the last few weeks, be aware of the following symptoms: severe headache, abdominal pain, leg pain, or shortness of breath. If you experience any of these, you should contact your healthcare provider and seek medical treatment immediately.